This is a fantastic endolaser we can use for many different indications. We can use for intravenous irradiation, like putting on an IV line for infusion. We can put a single optic sterile fiber into the vein and irradiate with every different color we want to use. The big thing for endolaser is red and infrared are fantastic for transdermal irradiation, but if I want to use the other wavelengths for the treatment, I need an endolaser. So yellow light does not penetrate. Yellow light is fantastic in regeneration of nerval damages. It's fantastic in depression. It enhances production of vitamin D. It enhances the production of serotonin. But we have to use this as an endolaser. Green light I can use intravenously for enhancing the oxygenation. And the other things for the endolaser, I can precisely put a needle into a joint space or close to a joint to bring the photons directly into the damaged area. I don't have to calculate how many photons will be absorbed, transmitted superficially, how many will scatter until they penetrate the joint space. But with the endolaser I can bring precisely the photons into the area where I want to bring them. So let's, for example, look into a knee joint. I could use a transdermal laser if I have only a hematoma, a bursitis. But if I have damage of the cartilage of the menisci, then I have to bring the photons as good as possible into the joint space. I just like to demonstrate how this could work. I preset a red light. I would use, after precise disinfection, maybe, not all patients require local anesthesia, I would bring in a needle into the joint space, and maybe perhaps we will give PRP, platelet-rich plasma, and or stem cells into the joint space, and then we would use the same needle for irradiation. So by this we can bring very precisely the desired amount of photons into the area where it's needed. And the great thing with red and infrared, it's not only, as it looks like here, it's not only a small focus, but red light spreads into the whole joint space, especially when I pre-injected PRP, when I pre-injected hyaluronic acid, and use the same needle for inserting a sterile single-use optic fiber and irradiate the joint space by this. And I have all the different other colors I can use, and now I'm happy to have the inventor of this device beside me. I just mentioned with the endolaser we have the terrific opportunity to bring the photons where we need it.
The main problem is, there are many laser machines on the world market, but nearly all machines, they treat with the laser from outside. And they hope that the light will go deeply enough into the tissue to achieve some healing effects, But the problem is that only infrared and red light can penetrate a little bit in the tissue, but the nice blue light, which is very nice, well, anti-inflammatory, or yellow light and green light, are not able to penetrate the skin and going deeply enough into the tissue. And for this, what you said already, we have developed fiber optic needles. That means in local anesthesia, we can put needles directly, maybe ultrasound guided or CT guided, in the right place in any depth of the tissue, and we can apply all different kinds of light, starting from ultraviolet, blue, green, yellow, red light, infrared light, exactly the full power of the right place. And then we can combine, of course, with platelet-rich plasma, what we can easily prepare from the bloodstream. It contains a lot of anti-inflammatory cytokines and growth factors, and then we can achieve amazing effect on chronic damaged tissue.
Yeah, I mentioned it's with just a superficial bursitis or local hematoma. You are fine by using a shower, a douche from outside. But if you have really bone arthrosis, grade 3, you really have to support the joint. The laser on its own has a terrific healing capacity.
We can bring the laser light directly into the joint with direct contact of the damaged cartilage inside the joint. And that's the main thing, and that's a new way of laser or phototherapy.
Yeah. And I think what really fantastic is that we can combine the laser with everything. We can combine with PRP, we can combine with stem cells,
with
hyaluronic
acid.
Exactly. Yeah. And it's not only, I just picked up as an example the knee joint, which is of course bone arthrosis, one of the most common.
Yeah.
And I think it's beside the wrist arthrosis.
Wrist arthrosis, shoulder is important, hip joint, ankle joint.
So we can use for other indications as well. So of course in the knee joint you may do it with ultrasound or just by palpating the joint space. Here we would need optical guidance.
Dr. Weber, can you kindly describe...
Which Dr. Weber?
First, Dr. Michael Hausweber, would you please tell that you mentioned that your device is unique in the market. Your device that you produced and introduced into the market is unique. Do you have any limitation for the wavelengths that can be used in medicine?
No, you're right, this device is absolutely unique on the market. What I told you before, there are hundreds of companies producing laser machines, but they're all working from outside, because outside is easy, every doctor can do it, even a nurse can do it. The intervention procedures, putting needles in joints on the spine, needs more knowledge and has to be done really by a well-educated doctor. And as far as I know, at the moment, this is still the only worldwide approved device for putting lasers using interstitial cannulas or different catheters into the body, either in the bloodstream, in joints, spines or everywhere. So this is a really unique treatment, and it opens up a new world of laser therapy. Because from outside, and you asked me for limitation, is there any limit? No. This device has 12 channels, and we have a new approved device now with 16 channels. And you can add any lasers what are on the market already or which might be developed in the future.
As I remember in your lectures, you sometimes mentioned that all wavelengths cannot penetrate into the body superficially. If the people use it transdermally, they cannot penetrate this type of the laser.
Yeah.
Therefore, it means that in many indications, many devices in the market cannot work,
Exactly.
even although they claim so. Therefore, can you describe that? What is the benefit in this topic?
The penetration depth of light or laser light is dependent from the wavelength. The shorter the wavelength is, the less is the penetration. Therefore, if you look on other devices on the market who works from outside, they normally work only with red light or infrared laser. They have a certain penetration from maybe 2-3 centimeters, but with short wavelengths, ultraviolet, blue, green, yellow, the penetration is maybe some millimeters, and you can never treat effectively maybe damage on the spinal cord or something in the joints from outside. It's impossible.
Perfect.
And there I think it's the unique is when we talk about the spinal problems. Red and infrared are fantastic, and most research over the last 4 or 5 decades has been on red and infrared light. However, we know from yellow light it's the most important color for neural regeneration. So we are happy if we have spine problems in the roots of the spinal cord. If we have inflammatory processes, you mentioned before, we are happy to use the blue light. And yeah, basically all colors that we know can be used.
Dr. Weber, another Dr. Weber, please. Which indications do you use this device in your clinic in Germany or Portugal? Which type of the treatments do you use this device?
Basically, as we know from the world, really we can treat everything from head to bottom. The laser is targeting the powerhouses of our cells, not only the mitochondria, but other cell compartments as well. So especially chronic systemic diseases are the main target. Superficial problems one can do with other devices, but if you have fatigue syndrome, burnout syndrome, if you have cancer patients, if you have autoimmune diseases, it's fantastic to work with all the colors. And this is another topic we didn't touch yet. We even can, let's say, reverse the effectiveness of the laser if we combine it with a photosensitizer, if we perform photodynamic therapy. Then we have a treatment even for cancer treatments.
Wow, wonderful.
Yeah, we have to distinguish between regenerative medicine and cancer medicine. Normally, cancer, you can read everywhere in the books, is a contraindication because laser is normally a stimulating method for cell growth. And that's good if we have arthritis or any other damaged tissue, but in cancer, we want to destroy the bad tissue. You don't want to let it grow, and that's what he said. We are doing photodynamic therapy. That means we combine the laser therapy with a special light-sensitive substance, maybe based on the chlorophyll molecule or on the HAM molecule. We can give this in the body, maybe by bloodstream, or inject directly into cancer. It will bind to cancer cells, make them light-sensitive, and then we give the right laser light according to the absorption spectrum of the photosensitizer, and then we produce a lot of radicals, oxygen radicals, which kills the cancer immediately. This is photodynamic therapy, which has a long history, and there are hundreds, maybe thousands of publications, what you can find even in the internet. But everybody speaks about the limitation that is working. We have not to discuss this. We know that it's working, but the limitation is that we cannot bring normally the light deeply into the body. Maybe treat a sarcoma or pancreatic cancer is not possible from outside, but using this new interstitial therapy with fiber optic, we can bring any laser deeply in enough maybe using ultrasound or CT scan or something in or on the tumor, and this is a new world of cancer therapy.
We fortunately heard that both of you are now in Emirates working on many treatments for diabetes type 1, infertility, impotency, for cancer treatment. Are you collaborating together to treat these patients in near future in Emirates? Can the patients make a contact for further information in Emirates?
I would say we would be more than happy for any patient that we can support with this unique method. And we know from chemotherapy, many of the tumors are smart. They develop resistance. But to what all we know about PDT, it remains working. So there is no adaptive effect of the tumor to this form of therapy. And we are collaborating with good laboratories, universities back in Germany who produce photosensitizers as we need them. When we say we need deep penetration, they put nanoparticular photosensitizers that can penetrate deep into the tissue. And yeah, you just mentioned the big difficulty in huge tumor masses is bring a good photosensitizer into the tumor, and the wavelengths that has the best penetration is infrared. So we are demanding good photosensitizers with deep penetration, and the best one at the moment is ICG, isn't it?
It's nano ICG, what we produce with small particles like liposomes or micelles. You know, we have micelles much smaller.
We even can decide, and we can put it on nano, and then you can decide how do we coat them. to get best
Yeah,
penetration immunized.
We have excellent cooperation with famous universities in Germany where we developed this new photosensitizers
Perfect.
with great experience. And yeah, and what I want to emphasize, I'm not against oncology. I'm not against chemotherapy. We need many things, It's always an integrative concept, but we know chemotherapy alone or radiation alone is maybe not enough. We can maybe extend the life of the patients, maybe in not good quality, of course, but this is a part, and not only PDT, but it's a very important part which enhances all other treatments in cancer and also enhances life quality. And that's
Perfect.
Very important point.
Dr. Hansweber, would you please mention that can this method used in any type of the cancer, or for example in leukemia it can be used, or no, it's just in solid tumors?
I think there is no limitation. There's so many studies done. Photodynamic therapy is nothing new. There are studies starting 40, 50 years ago already. There's a long history and it's used already in so many different kinds of cancer. I think there is no limitation on any, you can use it on any cancer. What not means is 100% successful in every cancer. Some cancers respond very well, some cancers not so good. It's like in chemotherapy, same thing, but you can improve everything when you combine different methods together. No?
I think what you mentioned is very important. It's not contradicting radiotherapy and chemotherapy. It must be integrative. So many times I get approached from parents, my child is diagnosed by common ILL. They have survival rate 10 years by 99%. I think this is classical chemotherapy. But we still have the way to support, to reduce the side effects of the chemotherapy.
Yeah.
And this is the fantastic thing we always can offer. And yes, to my experience, especially solid tumors are more sensitive than the leukemia. We get, well, it's FDA approved, for example. The white skin tumor, the basallioma, it's legalized, it's by PDT, but malignant melanoma, not that good results. Yeah.
And we heard that you are using stem cell therapy as well. Would you please mention that what are the indications of stem cell therapy?
Stem cells.
Yeah, stem cell.
Yeah, stem cell therapy also has a long history, and the problem with stem cells worldwide is, according to all this new regulation from US FDA and now in Europe, that the stem cells, especially what you can produce from the fatty tissue, so-called adipose-derived mesenchymal stem cells, is very limited now because it's regarded as manipulation to take them out of the fatty tissue. We have developed in Germany a new approved method to separate the stem cell from the fatty tissue by using indirect ultrasound sodication, which brings the stem cell out of the tissue, and is a mechanical method and is officially allowed. We have no approval from the German government. And this kind of stem cells can be used also with laser therapy. First of all, for regenerative purposes, because stem cell, when you inject a stem cell in a joint or somewhere else in the body, damaged tissue,